People want to know, why the hell would you even pick this as a profession? It's really one of the doctors that people are like, why would anybody want to do this? And it's filled with, everyone tells me how much they hate being there. Everyone's fearful. Everyone, tells me what they would rather be doing. I'd rather, I was in a motorcycle accident, and I'd rather, be dealing with that than
Right.
here. I'd rather be giving birth than being here.
Hi, welcome into Shed Talk. I'm your host, Sean, where we have inspirational stories and talk to small business owners all over the country. Also, we get some crazy stories. Sit back, relax, and enjoy the show. Welcome back into another show here on Shed Talk. My next guest coming in has a lot of achievements and a lot of experience, especially in the medical field. This is the person that you go see whenever that smile is not exactly what it used to be, or you want your smile to get back to where it was at. He actually has a DMD, and he also has a MD. He has several years and a lot of time in the medical field. Welcome in, Mark. How you doing this afternoon?
Good, Sean. Thank you very much.
Hey, man, I appreciate you coming on here, taking the time to talk to us and letting the general public know exactly behind the scenes of what you do. Can you give us a little bit, like what do you do when it comes to the surgeries, when it comes to root canals? What do you specialize in?
Well, we're oral and maxillofacial surgeons, so we deal with everything from wisdom teeth. That's where most people would know us from. Extractions, infections. We deal a lot with trauma. We usually are on hospital with other trauma teams, and kind of split that up with ENT and plastics. We
Okay.
do sleep apnea surgery. We do orthognathic surgery, which is where we really move the bones of the face, the jaws, the nose, the cheeks, and we move them so that people who've had deformities can have regular appearance, more traditional of what they're looking like. They don't have a severe overbite or underbite or open bite,
Okay.
or where they're mid-face deficient and very flat. We take care of that. Or if they have just a very prominent forehead. So we do a bunch of that. We do dental implants. Um, we do
Yeah,
bone
Mark, hey,
grafting.
real quick, man, going back, I was just thinking about it. I was thinking let's like small root canals, but you actually really get in, like pop the hood and you line things up, kind of like, the large overbite. Uh, you can realign the jaw. Is that correct? Or
Yeah. So we're root canals are for an endodontist or a
okay,
general dentist.
okay,
Um, and orthodontics will move your teeth and try to get you bite, but there's skeletal deficiencies and skeletal abnormalities that are you can't recover just from orthodontics. So you need to actually cut the jaws, cut the upper jaw, or you cut the upper jaw here, or you can cut the upper jaw up through here and move out the whole mid face. You cut the lower jaw, you can move it back. So we can just move the chin. So we reconstruct the face by doing surgery.
okay. So somebody that has sleep apnea, uh, is it sometimes besides losing weight, is it surgery that may be required for sleep apnea?
I'm biased. I think a lot of the traditional surgeries for sleep apnea,
Uh-huh.
where they go in and they remove the soft tissue in the back of your throat, like the little uvula that hangs down the back of your throat, and tonsils and soft palate. Those surgeries don't work great for sleep apnea. They work for snoring and some other things. What works great is we take the jaws in the bite that they're in, we we cut them,
Hmm.
move them forward, thereby moving the airway. We move the tongue, we move the chin. That opens up the airway, and then we fixate them to the new position. Um, that I think really cures sleep apnea. Now, not a lot of people aren't going to go to that extreme to do it, but it's a very well tolerated. It doesn't have the pain associated with, you would think, because there's a lot of initial numbness that goes with it. And it gives people a great look. It gives them more youthful appearance because a lot of times people have a heavier face and thicker jaws and they don't show teeth. And when you do this, you give them a stronger smile, brighter smile, and you take away, some of the laxity, and you give them a more just a youthful appearance. I think it's the best thing we have going. It's unfortunate that it's usually not covered well by insurances, and people certainly can't pay for it out of pocket
Right.
themselves.
Right. Now, is there a certain finances through in your practice that it may be available for people to help them out with that?
Yeah, I mean, we have different lending opportunities. We ourselves don't have any specific ways of doing it, but we participate with lending companies
Okay. Okay.
that
So somebody
that
can
you
get
could
a loan.
apply for. Yeah.
Right, 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 and finance it. I'm sitting here thinking about everything that you're describing that you do, how you adjust this. I can only, like, I guess you say, put it in the line of like readjusting the muffler. Like you're helping them, you're lining the muffler up so that they can actually breathe in their whole airway and everything can flow the correct way.
Yeah.
Like that's how honestly that's
That's
what I
it.
was
That's a
visualizing.
great analogy. What's really nice with the orthognathic surgery, that's where we do the similar surgery, but we do it because people have they have facial deformities.
Hmm.
Um, their eyes are too wide. They've got too prominent. Their mid face is sunken in. Their lower jaw is out too far. They can't close their jaws. Um, they're it's very upsetting for the person. They look like there is something that is wrong with them.
Right, right,
And everyone, especially when we do it on younger kids, they're picked on, they're low self-esteem and all. What's amazing is that with pre-orthodontics, to get their teeth into the right position, because everything's based off of your occlusion, the way your teeth come together.
okay.
But what's amazing is that you have these kids who you would look twice at and go, oh, there must be something going on there, to where we move them and immediately they look like beautiful, where you're just like, that is a great looking, it's just so instant. It's really not that instant because there's a lot of preparatory work that goes into it, but the final result is so satisfying. That's probably one of my biggest satisfactions of
Hmm.
oral maxillofacial surgery.
So it's kind of like you take away this discomfort look to a more of a natural look where they're more comfortable with the way with their appearance is. And it brightens up their day, right? And brightens up their life with that.
It changes them. People come from where they don't smile for pictures, they don't take pictures, they don't look up, they don't make eye contact, they don't take care of their hair. They wear these, clothes because they don't care. Everything is just shit for them.
Right,
And you
right,
you do this and you give them back a normal featured face. And when you see them a couple weeks down the road, their smiles, they are outgoing. They are now dressing so that so they're a completely different person because their whole self-image has been improved by what you've done for
right.
their appearance.
Hmm. Yeah, that is amazing there. Looking back at your history, I see that you have traveled and done practices pretty much all over the country. You've been in Hawaii, you was in Missouri, Rhode Island. What ultimately made you land you back here in Pennsylvania, brother?
Uh, well, Rhode Island's where I went to right after residency, and it was a
Okay.
practice that was some fine surgeons, but uh, a lot of what had me move on was the long-term plan wasn't what I expected it to be, or the long-term plan changed.
Okay.
And we went from Rhode Island. I was married with a, children when I was in St. Louis,
Okay.
and unfortunately got divorced. And I also got, if you can remember, H1N1, the
Yes.
bird flu,
Yeah.
and that put me out of commission for a good couple of months. And so I was like, I need to sort of change my environment a little bit. Went
Right.
to Kansas City, and there again just wasn't what I wanted for the long term. And at this point, I really wanted to be in my own practice, and I wanted to stay in the Midwest because my kids were out that way at the time.
Hmm.
Um, but there weren't any real opportunities that I wanted, and I'm from outside of Philadelphia, so to come back to Pennsylvania, I had missed it by this time. I looked, and there was a great practice by a doctor, and I'll say his name because he did a wonderful job, Charles Brzezinski,
Okay.
who had started this practice and was getting ready to retire. I actually sought him. So while I was waiting for this practice to become available, while he took care of what needed to be done to transition it, I went to Hawaii and worked at a practice for a couple months just to make some money and to, until my practice was ready. So that's how I did it. But I wanted to be back in Pennsylvania. I wanted to be back where my family was, where I grew up, near where I grew up.
Right.
And my daughter came and joined me.
Okay.
So that made it easier. And my wife, who I got married to in Kansas City, or I didn't get married to her in Kansas City, I met her in Kansas City. She came to the East Coast to do her work. And so I had kind of a new uh, group of people here. So it
Fresh
was
start,
it
kind
was
of like
nice. It was a fresh
a
start.
new start. Yeah, 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 yeah. I
Yeah.
get that there. Wow. Okay. What is some things that people would make an assumption about or misunderstanding about going to go see an oral surgeon? What do you find that people are like, oh my gosh, what's going on here?
People want to know, why the hell would you even pick this as a profession? It's really one of the doctors that people are like, why would anybody want to do this? And it's filled with, everyone tells me how much they hate being there. Everyone's fearful. Everyone, tells me what they would rather be doing. I'd rather, I was in a motorcycle accident, and I'd rather, be dealing with that than
Right.
here. I'd rather be giving birth than being here. Um, and I think this is true of, a lot of oral surgeons. I think because of, if you're properly trained and you're a good person, you can really get them to see you differently. And the medications definitely help too. That you can do. We do a lot of anesthesia. I'd say, 75% of our work is done in office with anesthesia. So we can really offer patients to be asleep for when we do their surgery, and that makes it easier. And what's really nice, what's rewarding, because it is hard constantly knowing that you're scaring the shit out of everybody who comes in there. It is nice when people leave and they really had a positive experience, and that's just because of, staff and
Yeah,
just the
the
atmosphere that
atmosphere
you
that you
give it.
set there, and I just got this feeling, Mark, that like the atmosphere there is very relaxing and very peaceful, and you guys listen to their concerns, and you guys give them exactly what they're looking for, right? Am I correct with
It's
that?
what yeah, it's what we try to do.
Okay.
We really try hard. We deal with a lot of young people. We deal with a lot of older people because of the, different issues that people experience.
Mm-hmm.
And typically, when we see someone back from who've already has seen us, they're much more relaxed and better because they've been through it. And that's one of the reasons why we do a consult before we do the surgery so that they get to know us a little bit and kind of change the expectation up. So that they're like, oh, I met them there. They seem all right,
Yeah, I think that consultation is a big thing, I think from what I understand that whenever you get there, you have your consultation, they explain to you exactly what that they would like to have done, and you go through the procedure and you tell them exactly what to expect, and you're very transparent. Is that how it goes?
Yeah, I mean, you really need to be transparent because if you're not and something goes wrong, which you're dealing with medicine and surgery and even some of the most straightforward things can arise that you didn't expect.
Okay.
Hopefully, it's nothing too serious, and hopefully, it's something that you can take care of, with minimal change to the plan. But if you're not transparent and you now tell the patient that they experienced this complication that they were not expecting or knowing about, you're gonna have to, that was wrong. And no one's perfect, and there's times where you don't always see things coming, or the communication between you and the patient
Oh,
didn't fully understand.
okay.
So you have to really try to be as transparent to make sure that that doesn't happen.
You know what, Mark? I think honestly, regardless of how well of a job you do, sometimes I mean, that's true. Everybody's not going to be happy. You can just do the best to your ability. And, sometimes they're like, I wish this was a little bit different. But I seem that your practice, how long have you been doing this practice for? How many years?
I got into this practice at the end of 2015.
Okay, 2015. You've been doing this for quite a while. But like I was saying, that I seems that some people will, majority of them are going to be happy. Obviously, you're still in business and doing what you do, so you do make a lot of people happy with this, what goes on. But the other times there are also that percentage that isn't going to be 100% happy, and I guess you guys
So
are transparent.
that's great because what happens is you're doing surgery. You're doing surgery in the mouth, which is a dirty place.
Hmm.
We're sedating people in the office. We are the ones administering the anesthesia. Um, Now I have a great team of people that I work with that
How many employees
help
you
me.
got at this point right now, Mark?
Uh, 12, I
Okay,
think. So
like a
I've
little
got
family in there, little family.
it is a little family, yeah. I mean, my staff is great. I can't do anything without them, and my surgical team really, they have their roles, and them being on top of their game makes it so that I can do what I need to do.
Right.
And I do. I have a nurse cat. I have a paramedic firefighter Joe. I've got a right hand assistant Michelle. Um, they have these roles where they know how to help me with the patient with anesthesia. They know what instruments to give me and what to do. I've got a great front desk team
Right.
that really deals with the patients and deals with the insurance, and that's another thing. There's always the insurance problems, that frustrations that go on that make people unhappy. And then there's a post-operative pain and knowing that someone's going to have some surgical discomfort and so don't always, you get happy people at times and you get unhappy people because of these issues too.
Huh. Okay.
And so
That's
I gotta say, because I don't want to get in trouble, we've got Jessica, we've got Jaden and Olivia at the front. And one of the best things that I did is I brought in a doctor, Dr. Stacy Mitchell, who does a lot of the consults, who's the nicest, sweetest person, and she really is a great person for making a first impression and getting, people's fears to be really alleviated.
that's awesome. Shouts out to everybody at the practice, everybody that's doing a fantastic job there.
Thank
That's
you.
That's great, man. That is really good. I want to ask you another question. What is one story, without getting into too much personal information, that really will stick with you and has stuck with you for quite a while to where you're like, this is why I do this? You have anything like that?
Yeah, I don't know that I can. It's actually it's stronger than that. There's several cases because we see people that have come in that are hopeless about their teeth. They've lived their whole life with shitty teeth and they don't smile, they don't go out, they can't eat, they're constantly in pain, they're infected all the time. And we do a procedure where we extract all the teeth and we place implants. And then we are able to that same day or a day or two later screw in a denture with teeth into the implants. And you do that and you give someone a brand new smile. You see the commercials like for Clear Choice.
Yes.
You know, that's sort of what you can offer people. And to see people go through that is great. When I was talking about the orthognathic surgery, the people who have had, had been picked on last week, and now you look at them and you're like, that is just a beautiful person right now. Like
Hmm.
they look great. And you know that
You brighten their day, you brighten their
you,
life. Now they can
you
smell.
right. And then we do a lot with, you know, we we do a lot with like incarcerated people. We see them. We see a lot
Really?
of yeah. We have several prisons and jails near us, so we
That you
do get to
service. Do they
that we
do they come to
service.
you guys or
They
you
come
guys
to
go?
us. Yeah, they come to us, and there's some of the nicest patients. They are most respectful, really, which is
Wow.
great.
Wow.
And we did a we've had a couple where people have had they're tough guys in prison and they have a lot of facial tattoos, and we've had to do trauma where we've had to reconstruct, but we didn't change what they put into their
Right,
face and their
right. I
tattoos.
understand.
And that's been great because we were able to take everybody, no matter who they are, and kind of give them back what
Right.
it is that they wanted. And those are just there's a lot of stories like that, and I really like it. Or the people who were close to having to be admitted to the hospital and have a major, surgery to help them breathe or whatever, and we're able to get the teeth out, get the tooth out, get the infection out, and they go on to live a normal life. It's really satisfying those kind of things.
Yeah. Sitting there, I was thinking about when you said some of the inmates and they actually were when there these inmates that came in there to see you, and is there some surgeries that they actually I would say like when they get those implants with the diamonds and the gold and stuff
No,
like
we
that?
we don't do that kind of stuff.
You don't do that
We
at
don't.
all.
No, we don't do teeth. We just do the implants. So we put the
Okay.
screws in. And an inmate's not going to be able to do that. They can only get emergency like extractions,
What, Mark? What is that? What
infections,
is that called? What is that
pathology.
called? What is that called? Those people that can get those. And what is that? Is that what kind of? What is that?
My staff has me do it for them every once in a while. Like we'll take a little like diamond looking thing and we'll glue it, we'll composite it to their tooth. So it is
Okay.
I do that for my staff, but not for the public. But
Okay.
I'm not a fan.
Yeah, you're not a fan for that. Keep what the good Lord gave you, or whatever
Right,
you get. Right now,
right.
so talking about that when we was talking about the grills and all that other stuff. Have you ever seen that rapper Gucci Man on
Yeah.
there? What happened to his teeth? Because he used to have those. Now he has like brand new like teeth. Like when he smiles great. Did he get all that pulled off, or what do you
I
think
don't know if
happened?
you got it pulled off, or I think what they do when you get crowns and bridges,
Okay.
you have to prep the tooth. You have to cut the tooth down to a little shape
Mm-hmm.
where you have enough room to stick a physiological size crown onto that tooth, have enough tooth structure to hold it that you can cement it to that and it fits well. but not too much so that you don't make a bulky tooth.
Oh,
So I think that's what it is. I think that the teeth were just cut down and what we call prepped
okay.
for a bridge.
Okay, so
I
for a
think.
bridge with that, so let me ask you this: whenever it comes down to technology using AI, where do you see technology from when you first started to where is it at now? Like, where do you
Uh,
see it
it's
going?
it's amazing. It's one of the things that makes practicing fun. The technology that we have now. When I did my residency, when we would do the surgery where we'd move the jaws, we would have to spend hours doing what we call model surgery, where we made models of the jaw and we
Mhm.
would move them and make a splint and move them into the positions, make a splint, and then that's how we would kind of guide the relationship of the teeth to each other, the relationship of the jaw to the cranial base. um, Now that's all digital. You do that digital and you make the splint. It used to be when you go to the dentist, they take the impression with all that alginate shit that
Yeah, yeah,
that
yeah, yeah.
gags. Now we do a scan.
Just a
We
straight
ran a
scan gives
scan
a
that, yeah,
straight detail.
yeah, and then so we had the CT scanners in almost every you know practices now have scanners like they have X-ray machines, so everyone can
Wow.
get a CT scan.
Yeah, I
We
remember those
have
days.
we have CAD cam printers and millers to make crowns and to make dentures and to make bridges and to make appliances that you had to make by hand before. Now you can just 3D print them out with the lab. And just the materials are stronger or better overall. Um, we can have things custom made. So, like when you're doing surgery, you used to have stock plates and you would bend them to the position you wanted them. Now you just send them a scan of what you're trying to achieve, and the plates come to you pre-bent. Um, just amazing. They're working on tissue engineering and what we can do, and um, using the materials, the bone grafting. It used to be if you did bone grafting, you did it with your own bone. And now we've got to where we can use human bone or animal bone in a really successful way that we don't need to take the bone from the patient and have a second donor site.
Okay. Okay. So, looking back at your journey at Penn State, at Temple, the University of Pittsburgh, UPMC, and now your own practice, what advice would you give to any young person that is considering this kind of medical career in dental work?
I I feel very strongly about this. You do not get courses that teach you about business. You are unprepared for the business side of dentistry, oral surgery, or any of the specialties. I wish I would have known stuff earlier on. I think the best way to really handle that is to get a good consulting group, and have them really help you with watching your collections, making sure that you're doing you just there's so much you don't know and so much that you're going to lose money on if with insurances, with employees, with payments being missed maybe. And when you have like a third party, especially in the beginning, helping to train and to maybe oversee, having someone who can consult and tell you what you need to do, what not to do, it would make a huge difference and save you just, you know, it's no exaggeration to say it'd save you $1 million or more dollars.
Wow. Wow, that's great information there. Hey, Mark, I appreciate you taking the time to come on to the show tonight, man. I really do appreciate it, brother.
Thank you. I really enjoyed it.
Yeah, right, man. Well, hey, y'all, this was another good show on Shed Talk. I'll see y'all later.